So the bacteria that was there on the wound of your patient has now seeped into the wound and gained access to the bloodstream. In this section, we'll see how the bacteria gain access to your bloodstream and may cause bacteremia and what is systemic inflammatory response syndrome. Then we'll talk about various conditions that might be present in the patient. We'll talk about hepatitis and HIV. These are some of the chronic infections that the patient might carry and how to manage them. And finally, we'll talk about the precautions which are required for a surgeon and the after contamination. So starting off with systemic infection, that is the bacteremia. There are four important sources. The first is unusual, which may follow a superficial surgical site infection. This can occur when the surgical site infection tend to drain through the wound itself. Now, it is common after the deep surgical site infection, such as it might follow a breach in the intestinal anastomosis. It can also, a transient bacteremia can follow procedures which are undertaken through the infected tissues. And finally, it can occur through bacterial infection of the indwelling intravenous cannulas. The most common organisms are the aerobic gram-negative bacilli, the Staphylococcus aureus, and sometimes fungi may be involved. Now, talking of the systemic inflammatory response syndrome, the systemic inflammatory response syndrome is the systemic manifestation of sepsis. So what happens? Bacteremia has developed. This bacteremia has spread throughout your blood. Now the body responds to a lot of bacteria in the bloodstream. The response of the body to those bacteria in the bloodstream is known as the systemic inflammatory response syndrome. So what are the other causes of SIRS or systemic inflammatory response syndrome? Multiple trauma can also activate this system. Now burns can activate this system. Now pancreatitis without infection can activate the systemic inflammatory response syndrome. Now serious infections and secondary peritonitis may lead to systemic inflammatory response syndrome through the release of lipopolysaccharide endotoxins from the walls of dying gram-negative bacilli or other bacteria or fungi. So actually the products of the dying bacteria and fungi are responsible for the activation of systemic inflammatory response syndrome. So what exactly is systemic inflammatory response syndrome? So the systemic inflammatory response syndrome consists of two of the following. The patient can have hyperthermia, that is more than 38 degrees centigrade, or hypothermia, that is less than 36 degrees centigrade. The patient can have tachycardia, that is more than 90 beats per minute. However, tachycardia is relative to the patient's heartbeat at resting state. This more than 90 should be with no beta blockers, or the patient might have tachypnea of more than 20 breaths per minute, and the white cell count is greater than 12 exponent 9 per liter or less than 4 exponent 9 per liter. So if the patient has two of these six, the patient is said to be in systemic inflammatory response syndrome. Now, sepsis is systemic inflammatory response syndrome with a definitive documented infection. Now, if you know exactly a definitive documented infection going on in the patient and the patient develops two of the above six symptoms, you say the patient is in systemic inflammatory response syndrome. Now, severe sepsis or sepsis syndrome is sepsis with evidence of failure of one or more organs. So now you have an evidence of sepsis, that you have evidence of infection or inflammation going on, and there's evidence of failure of one or more organs, be it the respiratory, the cardiovascular, the renal, the hepatic, the blood coagulation systems, or the CNS, any of it. So if a patient is in this condition, this is known as the severe sepsis or the sepsis syndrome. So moving on, let's see what are the systemic manifestation of sepsis. So a bacterial, fungal, viral or protozoal infection might come and activate the systemic inflammatory response syndrome. It can also be activated by inflammatory diseases. We can have massive tissue injury, they can also activate it. We can have multiple transfusions. They're also found to activate the SIRS. Then we can have burns, neoplasias, and other conditions. All of these can activate the systemic inflammatory response syndrome. Now, if the systemic inflammatory response syndrome is not coordinated and controlled, it can lead to multiple organ dysfunction syndrome, in which multiple organ systems, they become dysfunction. If the body does not recover from it, the body can proceed to multi-organ failure syndrome and shock, finally leading to death of the patient. So this is the figure that represents how the systemic inflammatory response is actually set in the body. So first of all, sepsis occur. This purple line is a sepsis or infection has occurred in the body. So the bacteria are in the bloodstream. The bacteria, they consist of the lipoproteins, DNA, the outer membrane proteins, the peptidoglycans, the fimbria, and the lipopolysaccharides. All of these have antigenic properties, and all of these are responsible for aiding and activating and further activating the systemic inflammatory response syndrome. So first of all, these act on the endothelial cells. So these bacterial antigens, they act on the endothelial cells. The endothelial cells, they release the tissue factors, and they also release the pro-inflammatory cytokines, the pro-inflammatory mediators. The pro-inflammatory mediators are responsible for the production of inflammation. They are pro-inflammatory, that is, they are for inflammation, go inflammation. So they give the body a signal that is, this is the time when inflammation is required in the body. So the body should produce inflammation. So these pro-inflammatory markers include the tumor necrosis factor, the interleukin-1, and the nitric oxide. Now the tumor necrosis factor, interleukin-1, they're actually also the chemotactic factors. Now these factors, they produce the innate immunity, that is the anti-infectious response. These factors are responsible for inflammation. What is inflammation? The inflammation is actually chemotaxis of the neutrophils, the mast cells, the monocytes, the macrophages to the site of breach in the body. So these are actually the interleukins, the tumor necrosis factor, the pro-inflammatory cytokines. They ask for the neutrophils, for the monocytes, for the macrophages to migrate and under chemotaxis, they should migrate to the site of inflammation. Now these neutrophils, these mast cells, they reach this site of inflammation, and after reaching this site of inflammation, they produce the inflammatory markers, that are responsible for destruction of the invading organism. These inflammatory markers include the reactive oxygen species as well. However, these inflammatory markers are not only damaging to the invading tissue, but also to the bodily tissues as well, because they are highly destructive reactive oxygen species, and they destroy whatever they come in contact with. Now what happens? This process of inflammation is carried on twofold, and the coagulation pathway, the complement system, and the fibrinolytic pathway are activated. As a result of activation of these pathways, there's widespread inflammation throughout the body. This widespread inflammation throughout the body is damaging to the body itself, and as a result of which various organ systems of the body, they start to fail. So inflammation as a response to a specific insult is nice, but when there's inflammation throughout the body, that is as a systemic response, that is something the body cannot cope with. So the organ systems of the body begin to fail, and the body enters multiple organ dysfunction syndrome, in which one organ of the body becomes in dysfunction with the other organs of the body, as a result of which the neuroendocrine pathway, the peripheral nervous system, the acute phase proteins, all of these, they are not in sync and coordination with each other, as a result of which the multi-organ dysfunction syndrome turns into multi-organ failure syndrome. And multi-organ failure syndrome is where the things begin to dwindle down. This turns to shock and the patient finally dies. Now, talking about hepatitis. Now we have a patient with hepatitis. How would you manage it? So hepatitis B and hepatitis C carry risk in surgery because these are the blood-borne pathogens. So many cases of hepatitis B are typically asymptomatic. You should always go for hepatitis screening in the patient. And once the hepatitis screening has been confirmed, only then proceed for surgery. The vaccination and proper treatment for hepatitis should be given to the patient and advised as well. For the doctors, you should always double glove yourself, prevent yourself from a prick injury if that occurs. You should always proceed to vaccination and proper treatment. In cases of HIV, it is transmitted by bodily fluids, particularly blood. It is a retrovirus. There's sexual transmission in intravenous drug addiction and in infected blood products. So these are some of the modes of transmission. Since in surgery, you'll be dealing with blood of the patient again. You should always ask for HIV history. You should always confirm the HIV history, and should always try to prevent yourself from contracting the blood or the bodily fluids of the patients directly. Now, involvement of surgeons with HIV or hepatitis patients. So these are the universal precautions. So use of full face masks, which ideally protect the patient, or protective spectacles should be there. Ideally, you should have a full face transparent mask, which should cover the entirety of the face, or at the very least, you should have the protective goggles. Now, use of fully waterproof disposable gowns and drapes, and particularly this should occur during the seroconversion. So whatever drapes and gowns are being used in the treatment or in the surgery of a patient with HIV or hepatitis should always be disposable, so that it cannot be cross-contaminated. Now, boots should be worn, not clogs, to avoid injury from the dropped sharps. So you should always wear boots and not clogs, because an injury from the sharp can be avoided this way. Now, double gloving is important, and for double gloving, always wear a larger size on the inside and a smaller size to the outside. It is more comfortable this way. Now, allow only the essential personnel in the theater. So no unnecessary people should be there. Only the essential personnel should be there. Avoid unnecessary movement in there as well. Should always avoid that. Now, respect is required for sharps. Should always pass the sharps with a kidney tray. So always put them in a kidney tray, take them from a kidney tray, and respect should always be given from, because a needle point injury can cross-contaminate and can cause transmission of infection. Now, a slow, meticulous operative technique is needed with minimized bleeding. So lesser the bleeding, the lesser the chance of contracting that disease. Now, what happens, how to after contaminate yourself. Now, in needle stick injuries, it is very important. Hollow needle injury that carries the greatest risk of viral transmission. Now, the injured part should be washed under running water, and the incident should be reported. So this was all about this section. In this section, we talked about the bacteria getting into the bloodstream and the response of the body. Then we saw the precautions that a doctor need to take with various bloodborne conditions like HIV, like hepatitis, and finally, we talked about the after contamination. I hope you liked and understood this section. For further sections, keep watching sqadia.com.